During my presentation, I spoke about the iStopMM study from Iceland. The Iceland Screens treats or prevents multiple myeloma. And this is an amazing screening project that has been going on since 2016, so almost a 10-year follow-up. And so it was an honor for me really to represent and present for the Iceland team to illustrate what has been accomplished with this study over this period of time. The population that was studied was over half of the eligible individuals in Iceland. And it resulted in 3,500 individuals being identified with a new monoclonal protein. And those individuals were randomized into 3 groups, one which was not informed at all, one which was followed by guidelines, and the other that was intensively evaluated. And the study has shown several very important things which I emphasized. Number one, that the disease is identified much earlier. Patients who develop myeloma actually are diagnosed 1.4 years earlier versus those who are not followed. And so this earlier diagnosis is extremely important in identifying myeloma earlier and having an opportunity to decide about the intervention. And so this was an important part for discussion. A key remaining question is, what are the best criteria to decide if intervention is required? Right now, we use the 2-20-20 system, and this can be quite helpful, although it needs to be improved. And so we discussed the use of genomics, the use of circulating monoclonal plasma cells, and also a dynamic model to see what would be the most helpful in identifying patients at the highest risk, those who might be the best able to safely benefit from treatment intervention. And so there was an active discussion about the 2-20-20 system, and then also the different kinds of therapy that can be available. I also discussed some important findings coming out of Iceland. One, that it's possible to identify if the bone marrow samples used for testing are hemodiluted. A very, very important algorithm has been developed that allows one to identify which patients are likely to have a higher percentage of plasma cells in the bone marrow. This is quite helpful to avoid unnecessary bone marrow testing. Overall, it's incredibly important that the Iceland study has changed the face of myeloma. Myeloma can now be diagnosed much earlier from the screening procedure, and one now has the opportunity to actively discuss if intervention can be importantly used.